Everyone, welcome to the nutrition piece of pre-op class. My name is Brittany Magner, and I'll go ahead and get started with the nutrition part here for you. Okay. First off, before we get started, I do recommend to get a paper and pencil or pen to take notes and write things down. Feel free to pause the video if you need to go grab that. We will have a test at the end for you to complete, so make sure you're watching those videos, paying attention, and write down any notes and questions that you might have. All right, so we're going to jump into the nutrition piece. So 2 weeks before your surgery, you want to make sure you're really following that pre-surgery meal plan well. Non-starchy vegetables, lean protein are really the basis of your meals. And this is what was given to you at your first nutrition class. This allows that liver to get smaller so that your surgeon can see your stomach better. So make sure you're following this really well up till surgery time. And now I'm going to talk over what I think is probably one of the most important things here for you, is the day before, the day before your surgery meal plan and the day of surgery. So the day before your surgery, breakfast, you want to do just something from that pre-surgery meal plan. And I gave an example there that you can see on the slides, something like eggs and a little bit of cheese. Lunch and dinner, still something from that pre-surgery meal plan. So lean protein, non-starchy vegetable. But at dinner, you want to make sure you drink your first Ensure pre-surgery that we've given you. And that is to help with recovery, improved recovery after surgery and quicker recovery. So do that first one at dinner time and then drink your second Ensure pre-surgery drink at bedtime. And I gave a recommended time frame there for you between 9 and 11. And then once it's midnight, that day before your surgery, no solid food after midnight. Day of surgery, clear liquids up to 4 hours before your surgery time. So that would be stuff like water, broth, or sugar-free flavored waters. And then when you hit that 4-hour mark before your surgery, that is when you're going to drink the third Ensure pre-surgery drink. And then after that, I don't want you eating or drinking anything before your surgery. All right, so now we're going to go into your diet in the hospital. So for this day of surgery, you're given ice chips. Take those slowly. Anything you want to go slowly with. Day after surgery, you're going to be on a clear liquid diet. They'll give you sugar-free Jello, broth. So you see those two little plastic cups there. One will have sugar-free Jello, one will have broth in it. And then they'll also give you a protein drink. Ensure Max and Isopure are the two options for you. And 2 ounces is the maximum that you'll have at breakfast, lunch, and dinner meals. That protein drink that they give you on your meal tray and your Crystal Light to sip on in between your meals. The actual meal is your 1 ounce of sugar-free Jello and 1 ounce of broth. When you go home, you'll be on clear liquids, but your protein drink can be creamy, milk-based. It does not have to be clear. In fact, the Ensure Max that they give you in the hospital is a creamy protein drink, but your surgeons have approved that. And always make sure you're following your discharge instructions from your surgeon. All right, so we're going to review some behavior modifications. Anything after surgery, I want you to make sure you're taking your time, whether it's your fluids or your food. When it is solid food, we recommend to chew each bite 25 times, and I would count in the beginning to get used to that. That can really help decrease nausea and vomiting after surgery if we're taking our time and chewing food well. Stop once you're satisfied. If we're taking our time, we're more likely to do that. Remember, it should take 20 to 30 minutes to eat a meal, and that includes even when your meals are only 2 ounces after surgery. That should still take you about 20 to 30 minutes to consume that 2-ounce meal. Make sure you're sitting upright at mealtime. Helps things flow better and digest better. And then get up and walk at least about 10 minutes after each meal. That's going to help aid in digestion as well. So getting up and walking after meals is a great thing to remember to do. And then small serving pieces, baby spoons, appetizer forks can just help promote those small bites so we're not taking too big of a bite at once. You want to think of your bites of food after surgery as pea-sized bites. 64 ounces of fluid is your goal to continue to aim for. It's going to be difficult at first. Keep track of your fluid intake. Anything that you drink counts. It will come with time, but you really want to work at getting that fluid in. So keep track of that so you know where you're at with your fluid intake. Reminder to not drink at mealtime and for 30 minutes after. You're not going to be able to get your meal in if you're trying to drink at the same time. And then when we are getting back up to solid foods, eating and drinking together or too close together can actually thin down that food in the pouch. It passes through the pouch faster, and then you're left feeling hungry sooner. So really practice not eating at mealtime and for 30 minutes after, even right now, before your surgery, so that you're used to doing that. It really helps surgery work better for you if you avoid the fluids at those times. Continue to keep a food log. If you're having trouble tolerating something, write that down, bring it with you to all of your appointments, or if it is a virtual appointment, have that there with you to review with your physician and the dietitian. And then make an exercise plan. Don't forget about the movement piece. Planning out exercise can help you stick with it. And that's going to be very important in your weight loss journey as well, is the movement aspect. Really continue to work at 3 meals a day. Skipping meals will not help with your weight loss. In fact, it can slow it down. So make sure we're doing those meals 3 times a day. When your diet is advanced up to solid foods, so we're on the second bullet point here, I don't want you to continue to drink your meals for the rest of your life. So that solid food, though, fills us up faster. So don't be surprised if you get fuller faster when you do advance up to solid foods. If you're tolerating them just fine, go ahead and advance up to those solid foods as long as your dietitian or surgeon has told you to do so. Just know that you might not be able to eat that full 2-ounce meal anymore because it is going to fill you up faster. 2-ounce meals in the beginning is the maximum. You can always eat less than that. Don't force yourself. 2 ounces is just what I don't want you to go over for your meal. And then lastly, make sure you're measuring your foods by volume. You don't need a scale. That's going to tell you the ounces in weight. I'm concerned with how much physically fits in your stomach. And a 2-ounce meal would be 1/4 of a cup measuring cup. So make sure you're doing things by volume, not using that scale. All right, now we're going to go into some review with protein. Protein is very important after surgery. No matter where you're at in your journey, I want protein to make up at least half of your meal. It's going to help you heal better. It keeps you satisfied longer. So I want you to eat that protein first, not your vegetables. Eat your protein first. And it's going to help maintain muscle mass, which is important in our weight loss as well. So make sure that you're focusing your meals around protein more. Your recommended protein intake after surgery is 60 to 80 grams per day, and I would track that in your journal too. In your manual that you are given, there is a table in there in the diet and nutrition section that tells you the protein content of various food sources, so that's very helpful. Why do you need protein? Again, to help you heal, maintain that muscle mass, help you with your weight loss, but you're not going to be able to get much protein in from food. Majority of that's going to come from your protein supplements after surgery to help you get to that 60 to 80 grams. As time goes on, though, we're looking at the third bullet point here, you will be able to get more protein in from food as you're able to eat more at mealtime. So as a result, we can cut back on those protein drinks. And you're going to be coming in and following up in the office for appointments, and we'll kind of help guide you with that. But the best way for you to know is to track that in your food. Okay, so what kind of protein supplements can you do? There's a lot of different varieties. Ideally, first off, though, we do want those protein drinks to be in between your meals. Your binder, your manual has some additional suggestions in it. But here are your guidelines. So under 200 calories per drink, at least 20 grams of protein, and 5 grams or less of sugar per serving. Whey protein's the preferred type. Whey protein isolate's even better. But always read the label with things. You'll see kind of in the smaller print there, not all Ensure, Boost, and Slim Fast are made the same. They do have some really great products that meet our guidelines. However, they do have some higher sugar products that aren't going to be appropriate for you to do after surgery. So always look at that nutrition facts panel on your protein drinks or the powder and make sure that it meets those criteria. There's some different options. So these are pre-made ones. Most of these you can find at your grocery stores, and I put in here where you could find those at. These are pre-made, so these are really easy grab-and-go protein drinks. Premier Protein's probably the most popular one that I have patients report that they do, but there's several different options. Muscle Milk, Isopure, that one there that you see, that red bottle, that's what you'll get in the hospital. It's just a smaller bottle for what they give you in the hospital. Ensure Max is the other one that they'll give you in the hospital. Pure Protein, yes, these are just a few examples of what you can do. And again, your manual has more options listed in there. Powders are another way that you can go with these. So here are some powdered options. I will highlight a couple of these. So GenPro, that black container there, is a flavorless protein powder. So this one's very popular. You can throw it into your Crystal Light and turn that into your protein drink, and it's 30 grams a scoop. So that's a very popular one. You're just not going to find it at your grocery stores, more GNC online vitamin shop type stores. Another one that I would highlight here would be your Undri. They do have a couple more savory type protein options. They have some soup flavored ones, chicken soup, and I think a Santa Fe chili is the other one with that one. And they do have those in ready to drink as well, which I have a picture of that there. But powdered ones are appropriate use as well. You just mix that with either water or skim milk. An unsweetened soy or almond milk would be appropriate as well. All right, so now we're going in to your different diet phases. So we talked about the day before your surgery, the day of your surgery, and now we're kind of just starting kind of back from the beginning a little bit from in the hospital at phase 0. So phase 0 is your clear liquid diet, which is what you'll be on in the hospital, but you'll see in red here, you're going to be on this diet for weeks from your surgery date. So this is another good thing to write down and note is, I'm going to be on that clear liquid diet for 2 weeks. I had surgery on this date, so I'm going to be on it for at least 2 weeks from that date. You're not doing any more than 2 ounces per meal, no matter what surgery you're having here. Make sure you're sticking to sugar-free Jello, broth, dill pickle juice would also be okay to do. And it's okay if you can't do that full 2 ounces. So this is your first phase that we're going to go through. You're still doing protein drinks at this time as well. Then we're going to go on to phase 1. So phase 1 is your full liquid diet. You'll be on this for another 2 weeks, no more than 2 ounces at a time. So that volume has not changed. It's again okay if you don't do the full 2 ounce meal. And again, remember to sip on your protein drinks in between your meals. So if you're looking at your phase 1 in your manual, once it has this kind of intro, how long you're on the diet, and it gives you an example menu or a meal plan in your manual as well. Then on the back side of that, or the next page, is going to be this information here. So what exactly can I have on that full liquid diet? So your milk products would be okay, and I got some various ones listed there. You could do a light yogurt, no fruit chunks in it though, and I would prefer it not be Greek because that's kind of thick for this phase. You could advance up to Greek yogurt once you're on to the next phase, the pureed. So an example for yogurt, like a Yoplait Light dessert flavor, doesn't have any of those fruit chunks in it. Plain oatmeal you could do. Make sure it's runny though, not thick, no more than once a day because you're not really getting any protein here. You could also do a low-fat cream soup, something like a Campbell's Healthy Request or a generic equivalent to that. And then you could also do a sugar-free, fat-free pudding made with skim milk on that full liquid diet. Okay, so the next piece I'm going to go through here is your vitamins. The reason I'm not going through, your pureed, your soft foods, and your solids on this PowerPoint with this presentation is because you'll remember clear liquids is for 2 weeks, full liquids is for 2 weeks. So that's going to get you through your first month out from surgery. You're going to come in about a week after your surgery and 6 weeks out from surgery. So you'll meet with a dietitian at all your appointments after surgery, and they'll review all the diet information with you. give you dates exactly for when you need to advance up to that next phase. And they'll review your pureed, your soft, and your solid diets with you when you come in for your appointments. But this what we're covering here gets you through that first 4 weeks. And all the information is in your manual if you kind of want to look ahead a little bit too. Okay, so now on to vitamins. So they're going to be a little bit different based on what surgery you're having, and they do need to be chewable for the first 3 months for improved absorption and tolerance. After 3 months, you can switch to like a Tic Tac size pill or smaller vitamin. Second bullet point, important one to note here, you don't need to start your vitamins until after you come into the office for your first follow-up appointment, which is about, again, 1 to 2 weeks post-surgery. So we're going to give you some time off of those vitamins before we have you start them back up. Okay, so why do I need these vitamins? Malabsorption. So especially with gastric bypass, that first portion called your duodenum is bypassed. Food no longer flows through there. So we have decreased absorption of nutrients. And then with both procedures, you have less acid in the stomach, which that acid helps break down nutrients for absorption. So we have a malabsorption component there with the surgery. And then we're also restricting how much you can take in. You just can't physically take in the nutrients you need through food alone anymore. And please remember, these vitamins are for the rest of your life. It's very important that you continue to take them, and we'll monitor your lab work and adjust things as needed. But these vitamins will be for the rest of your life to make sure your body gets what it needs, but then we can also keep the weight off too. All right, so this is just a little diagram kind of showing where different vitamins and minerals are absorbed throughout your digestive system. And this one's showing the gastric bypass here. You'll see the part that's shaded in dark gray is where food is no longer going to flow through anymore. And you can see those different branches coming off of that area, and all those different nutrients that are listed there, that's their main site for absorption. So that's where it becomes so crucial that you take these vitamins so we can maintain your health in other aspects, but keep the weight off. All right, so what do you need to take? So we recommend these vitamins here that I'll go over with you. There is another video that's attached here that we'll send for you that goes over strictly just how to purchase them. I'm going to talk a little bit more about what exactly you need and why it's important, but the purchasing websites are still listed here on these slides for you. So we want you to do a multivitamin. We recommend that you do either the chewable ProCare Bariatric Multivitamin or the chewable Celebrate Multi-Complete Restrictive 45. Both of these multivitamins are 1-a-day multivitamins, and they're fairly inexpensive. So choose one of those options, and you would take that once a day. Make sure you select the chewables, though, for those first 3 months, not the capsules. Both of these products that are listed here have a lot of important nutrients in them for you, and I listed some of those there. And when you look at something that's over the counter, the reason we're recommending these bariatric multivitamins is because an over-the-counter multivitamin is not going to give you enough of what you need, specifically a lot of the different nutrients that I have listed here towards the bottom of the slide. So make sure that you're choosing something that's going to meet your needs, and when in doubt, always call us before you purchase something. So both of these products, both of these multivitamins that we want you could choose either one, but you're going to take it once a day. They do have iron in them. So you can't take iron and calcium together. It needs to be at least 2 hours apart. And calcium is the other vitamin I'm going to cover here next. Okay, so calcium has to be broken up. So I'm going to start at the top here. It has to be broken up throughout the day. Your body can only absorb about 500 milligrams at one time. So we do recommend that you space those about 2 hours apart from one another. And you're going to do that calcium 3 times a day. Sorry, I had a little bit of a glitch there. You're going to take that calcium 3 times a day. If you're having the Roux-en-Y gastric bypass, I only want you to do calcium citrate because your body absorbs that better. So you'll do calcium citrate, 500 milligrams 3 times a day for a total of 1,500 milligrams a day. You're having the sleeve, same dosage, 500 milligrams 3 times a day, but you could do calcium citrate or calcium carbonate to give you that total of 1,500 per day. And a lot of patients find it easiest to take this at mealtime. So take 1 calcium at breakfast, 1 at lunch, 1 at dinner. And then I recommend like maybe in the evening before bedtime to take your 1 a day bariatric multivitamin. So you'll be taking something 4 times a day with how things need. Okay, so why are the vitamins important for you? What do they do for your body? So we're going to go over a little bit of that here. Calcium is important mainly for your bone health is the biggest concern, but it is involved in other things like muscle contraction, heart, brain, nerve health function, and blood clotting. So deficiency can lead to osteoporosis, increased risk for fractures. So taking that 500 milligrams 3 times a day is very important that you do. So here's some examples of some different chewable calcium options. The ones in the bags there are more what we call chewy bites. They're kind of more the texture of a caramel chew or like a Starburst, and they come in various flavors. The one in the bottle is more of like a tablet that you chew. And those are a little bit more affordable. So vitamin D is in your multivitamin. You get your vitamin D dosage within that multivitamin, but its main role is to help with absorption of calcium, but also phosphorus to help with your bone health. So if you're deficient in vitamin D, increased risk for, again, fractures, osteoporosis, decreased energy, fatigue, mood changes can also happen with vitamin D deficiency, just to name a few. So how much vitamin D do you need? At least 3,000. If, again, you take one of those bariatric multivitamins that I discussed already, you'll be getting that 3,000 IUs that your body needs. Some of you were, if we're looking at the second bullet point here, some of you were probably told to take more than 3,000 IUs because your vitamin D came back low before surgery. So if we had you bump that up, you'll just continue that higher dosage, maybe getting like a separate 1,000 IU tablet from something just at your local store. Your calcium will probably also have some vitamin D3 in it, so check that, see how much you're getting there, and you can count that towards your additional dosage. Okay, some examples of vitamin D3 that you could do are listed here. A couple of these, the Nature Made and Sundown, you can find at your local pharmacies. The Sundown Naturals does have a good chewable option that you can get at your local pharmacies. The Bariatric Advantage is one from a bariatric company. B12 is another vitamin that you're going to get in that bariatric multivitamin, so you'll get that dose there. But this is important for red blood cell production and nervous system function. So if you're not getting in enough B12, you can have an anemia related to B12, neuropathy with tingling in the hands and the feet, poor muscle coordination, weakness, loss of balance, neurological conditions. The last 4 of that deficiency are if we're having a pretty severe deficiency. But we want to make sure that we're taking that multivitamin that has the B12 in it daily so that we can prevent a lot of these issues. Iron. So again, that multivitamin is going to have your iron in it. Red blood cell production, iron helps with that as well. It helps transport oxygen throughout your body with the hemoglobin. If you're a premenopausal female, you're 2 times more likely to develop an iron deficiency. So even more important that you're taking that multivitamin with iron in it. Iron deficiency can result in anemia related to iron. So the symptoms of that would be weakness, fatigue, pale skin, increased risk for illness, affects your immune system. And then a severe deficiency could be more with impaired cognitive function. So again, the vitamin D, the B12, the iron, that is all in that bariatric multivitamin that we've talked about. Some things to avoid would be gummies and patches. So gummies and patches don't give you what you need, especially those gummy vitamins, the patches, there's just not a lot of research around those with how well you absorb that, so we recommend to avoid those as well. Vitamin deficiencies, it can take months, sometimes even years before a deficiency does show up in your lab work, so make sure that if for some reason you get off track with taking your vitamins, we get right back to them so that we're not developing that deficiency down the road. And make sure you're continuing to get your routine lab work done and following up with your appointments, because that's going to alert us to something if you are developing a deficiency at some point with that. And I really like, you'll see on here, these pill boxes. These are really nice because you're taking something 4 times a day, and there's 4 spots for you to put things at. You can find these at your local pharmacy or on Amazon or online. So in summary, with the vitamins, first off, if any of them make you sick, you can't tolerate them, call us, let us know. We can go over alternatives with you. Just please don't quit taking them altogether. Your vitamins can be found online. When we are able to resume selling them in the office again, we will. And then there are some over at the Walgreens pharmacy in the hospital too. So we do recommend, you'll see at the bottom there, to bring all your vitamins with you to your appointment so we can review that with you, and always call us if you have questions about them. All right, we're going to go over a little bit with review with fluid. Fruit juice you want to avoid completely. There's too much sugar in the fruit juice. Carbonated drinks can expand and stretch out that stomach pouch. So even if it's 0 sugar, 0 calories, if it's carbonated, I need you to avoid that. And then a reminder to not drink at meals and 30 minutes after. Make sure we're sipping, don't gulp. Takes about, about 1 ounce every 15 minutes is kind of a good way to gauge your fluid intake right after surgery. So it'll take you about 15 minutes to do 1 ounce. Caffeine, we want to avoid. It can dehydrate you, stimulate the appetite. So caffeine we will have you avoid in the beginning. And then we recommend to not use straws, primarily because most people drink faster with a straw, and that can cause discomfort if you take in your fluid too fast. Some tips for getting your fluid in. Get a water bottle that's labeled with the ounces, kind of like that Nalgene bottle that's there, and there's all different kinds available out in the market. 4 regular water bottles, those 16.9 ounce ones, would give you your 64 ounce fluid goal. But here's the thing, you're doing protein drinks too. That counts towards your fluid intake. So make sure you're giving yourself credit for all that fluid that you're getting in, even outside of plain water. If you do something, like Crystal Light, it tastes too sweet, try adding just like a half a packet into the water. And that might be helpful and maybe encouraging to help you get more fluid in if you actually like the taste of that. And then set goals. There's that 1 ounce every 15-minute goal. And then you'll see that kind of water bottle at the bottom there. That is someone who took their water bottle, used a Sharpie, and put time frames. So by 8 a.m., her goal was to be down to the first line, and so on. So you can get creative with that. Set reminders in your phone to drink fluids throughout the day if you tend to forget. Here's a variety of different fluid examples that you could do. A lot of these are like your sugar-free flavor enhancers, but you can do things like decaf coffee and tea. If you want to put like, lemons or limes into your water, that would be okay as well. Lactose intolerance can develop after bariatric surgery. So just want you aware of that, and the symptoms are listed here. If you experience any of these symptoms, it could be lactose intolerance. Most protein drinks, though, don't have lactose in them, or they have a very small amount. So don't throw those out right away. If you do think you're lactose intolerant, you could do a lactate milk or a lactate pill, soy, unsweetened almond milk. But most people, luckily, can still tolerate cheese and yogurt. It is a dairy product, but it doesn't have as much lactose in it, if any. Okay, dumping syndrome. So many of you have probably heard of this. This happens with ingesting in high carbohydrate, high sugar foods. So what happens with dumping syndrome is food enters that lower end of the intestines too quickly. So if my hand is like your stomach pouch, you eat something with too much sugar and it dumps into your intestines rapidly, too fast. So that stomach doesn't have a chance to really break that sugar down. And as a result, you have the symptoms of abdominal bloating, vomiting, rapid heart rate, sweating, flushing, weakness, sleepiness. You can have things like diarrhea, not as well. And that's because your stomach should have started the process and started to break that sugar down. And once it dumps into your intestines, your body just wants to flush it out and get rid of it. But where you'll see in, excuse me, let me jump back a little bit, phase 2, the pancreas also responds and releases insulin. But that insulin can't do anything because that sugar wasn't really broken down, it dumped. So it's going to bring where your current blood sugar down a little bit, and it causes a little bit of a low blood sugar with that, which is where you're going to get some of the symptoms maybe of like sweaty, lightheaded, flushing, things like that. So how do I avoid dumping syndrome? Well, you can read the label would be my best recommendation. So make sure you're always reading those. Third bullet point down, 5 grams or less per serving is what you want to aim for so that we can avoid that dumping syndrome. If it's high sugar, it's probably not good nutritional quality, so we want to avoid it even if you don't develop dumping syndrome. Some foods use sugar alcohols to sweeten them, so you just have to be careful with those because they have a laxative effect. And it will show up on your nutrition label. It will say sugar alcohols on there. A lot of that throughout the day can have a laxative effect. So just be aware of that, that could cause that. You don't want to do too many sugar-free things, at once. Things like sugar-free ice cream, cookies, cakes, candies, sweets. They might be sugar-free, but oftentimes they're still high in carbohydrates or fat. So I would recommend to avoid those. The only sugar-free things that I recommend would be sugar-free Jell-O, sugar-free popsicles, or sugar-free pudding. Hidden sugars could be in things like salad dressings, barbecue sauces, ketchup, marinades. So always read the label, no matter what it is. Too much fat can upset your stomach too, kind of like sugar. So avoid anything that's fried, high-fat foods, sauces, condiments, gravies. If it comes when you're looking at more of your dairy products or condiments, choosing the light or the reduced fat version usually will help you avoid any upset stomach related to that. Okay, so a couple more slides here. When can I eat more? So gastric bypass and sleeve, whichever procedure you're having. 3 months after surgery is the first time we'll advance you up, and you'll go up to 3 to 4 ounces of food per meal. When you're at 6 months, we'll go up to 5 to 6 ounces maximum, and a year 7 to 8. And 8 ounces, which would be like a 1-cup measuring cup, is where we're going to have you stay permanently. Always know that if you're not ready, like if you come in at 6 months and you're still eating 3 to 4 and feeling really satisfied off of that, and you're like, I don't think I could go up to 5 to 6, you don't have to. Listen to your body, do what feels comfortable. We're just saying it's okay at that point if that 3 to 4 ounces isn't satisfying you more to go up to the 5 to 6. And then again, so we're going to kind of gradually go up, and 8 ounces is where we'll have you stay. Long-term success tips. Regular follow-up appointments are very important. So make sure you're coming to those, getting your blood work done. You'll meet with a dietitian and the provider at each appointment, each regular scheduled appointment. Most patients in terms of weight loss are going to experience the most rapid weight loss in the first 3 to 6 months, and then continues, but just a little slower up to 12 to 18 months out from surgery. So that was all I had, everyone. I hope that answered some questions for you. If you have anything that you've written down, we'll go over those with you. And good luck in your journey, and I can't wait to see your progress, and have a good day.